Dame un grr.
¿Un qué?
Un grr.
¿Un qué? ¿Un qué?
Un grr.
¿Un qué?
Un grr.
¿Un qué?
Un grr.
Mi combo de aumento de senos y lipo 360 en Miami me encantó.
Creo que combinar cirugías es una opción más que válida. Ahorramos tiempo, que es muy valioso, la recuperación, ahorramos también en lo que es los masajes. Es como tener, yo digo, un todo incluido. Hola, soy Juliet, pero antes de que te siga contando un poquito más de mi cirugía, haz clic en el enlace de acá abajo y reserva tu consulta gratis ahora. Si yo me volvería a operar, me volvería a operar 100%. Creo fielmente que las cirugías nos aportan muchísimo desde lo emocional, el autoestima, nos hace sentirnos mujeres más seguras, más empoderadas. Entonces sí, a mí mi combo me encantó. Aumento de senos y lipo 360. Haz clic abajo y reserva tu consulta gratis.
¿Qué es una lipotransferencia? La lipotransferencia combina la liposucción con una transferencia segura de grasa a los glúteos. Obtendrás una mejor forma en el abdomen, la cintura, las caderas y los glúteos. Si deseas una consulta gratis conmigo, haz clic en el enlace de abajo.
Dame un grr.
¿Un qué?
Un grr.
¿Un qué? ¿Un qué?
Un grr.
¿Un qué?
Un grr.
¿Un qué?
Un grr.
What makes a BBL look good? It's not about adding fat. It's about creating proportion, a balanced waist-to-hip ratio, smooth projection, and natural contour. That's what I aim for in every single case. I start with 300.
Good afternoon, everyone. Good afternoon, Miami. We're here with Dr. Sadio, our amazing doctor, and we're going to be talking today about surgical procedures, frequently asked questions, specials, and like I said, if you have any questions that you would like to know a little bit about, send it in the comments because we're going to be reading all of your questions, all of your comments. So let's say hi to Dr. Sadio.
Hi, everyone. Good to see you. Good to be here, as always.
Awesome, yes. So I'm going to be trying to translate to Spanish here and there. Okay, so mi nombre es Wilmar y estoy aquí desde Miami, Florida, con la doctora Sadio, doctora espectacular como ser humano y como profesional. Si tienen alguna preguntita, la pueden enviar por los comentarios y las vamos a estar respondiendo. Méndez, si tienes alguna preguntita, por favor envíalos a los comentarios y te vamos a responder con mucho cariño. Okay, Dr. Sadio, let me ask you, can you tell me a little bit about the procedures that you do?
Okay, so my practice is all body contouring pretty much. So I do lipo 360, BBLs. I do breast work, which is actually was not a big part of my practice before I came to Miami, but there was so much demand and I got back into it. And now that part of my practice has grown so much.
And you do so good too.
Well, thank you. I mean, I just hadn't kind of fallen away from it, and it's been really a pleasure to get back to breast work. So breast dogs, breast lifts, and those are my main cases.
Awesome. Do you do combos?
I do combos.
Okay.
I love the art of staging combos. So one of my favorite patients is the patient who comes in and says, "Just fix me," and they want kind of everything done, and we start them on a journey and on a path, and we figure out a plan.
Right.
A step-by-step plan,
especially
to
for
get them to
that
their
patient,
goal. Yes.
because something that a lot of people don't see is that we like to evaluate cases individually, because it's not the same to evaluate a patient that has had kids to a patient that has never had kids. So it makes such a big difference. So that's why we usually ask for pictures when we're doing the consultation. We ask for medical conditions, if they take meds, because it makes such a big difference, right?
Absolutely, it's so important. Every procedure is, or every patient is a work of art. And also, patients have different aesthetic values. Some patients want a very natural look. I've had bodybuilding patients. I had a bodybuilder who has she wanted a very particular look. I've got patients who just want to look just very natural, just a little bump up from where they are.
Because sometimes they just want to enhance what they already have.
Exactly.
And that's the awesome thing about plastic surgery, that you can do even a little change to make you feel better, or a big change. For example, when I did my first surgery, I was 18.
Oh,
I had
wow.
no breast.
Oh my gosh.
And I was so self-conscious.
Yeah,
So in that case, I did implants, and I remember I just did some small implants. Nobody will know if I did surgery or not because it was so like proportionate to my body.
Yeah, good.
So question, doctor, do you have a BMI requirement?
BMI is, it just depends on the case. And also BMI, the number is helpful, but everyone is different. Some people have a huge, all their BMI is in their hips.
Correct.
And they want lipo. And some patients might have a smaller BMI, but they have a huge amount of fat maybe. And so it really is, it just depends on the case. I just
the
like
patient.
to see obviously at the extremes, there's a BMI, I think like over 40, we just can't, is difficult to do an open case under general anesthesia. But if you, I never, here's why I don't like to give BMI limits. Tell me what you want and we can get you there. So I don't want someone to see a number and then say, oh, well, I'm not a candidate. No one can do anything for me. Tell us what you want, and we'll get you there.
You rather get like a plan of action.
Exactly.
Basically. So
exactly.
I want to look like this. This is what I look like. What do you recommend as the doctor?
And maybe that starts with weight loss. Maybe you come for your consultation and we say, okay, well, here's how we can get you there, or we can start you with a targeted lipo procedure.
Right.
And that's where like what I'm doing under local anesthesia could come in.
Awesome.
The very high BMI patient who maybe doesn't qualify for general anesthesia or who is not a candidate for an open procedure could have awake lipo.
So you're okay with doing surgery under local anesthesia?
Right, lipo under local anesthesia.
Liposuction and BBL
Correct.
or liposuction
and
only?
And BBL.
Oh, so this is great news, everybody. We're going to be doing liposuction and BBLs under local anesthesia. So if you're maybe a little scared of the anesthesia, because that's an important one as well. Some patients don't want to go under completely, which is okay. We respect that. So now we have this for you. You can do liposuction under local.
Under local, yeah, and there's an art to it. It's not the same procedure. Lipo under local is not just lipo, but under local. It's a completely different approach. Then there's an art to the numbing. I've done thousands of cases under local, and so I've got a lot of experience with that patient and making sure that they're comfortable. It's super important.
Right. Okay. Now, something super important. Even if you're doing surgery under local anesthesia, we still care about your safety.
Of course.
So the patient still has to do, I'm sure, blood work, EKG, medical clearance, because we want to make sure they're okay.
Yes, we still need a clearance. We still need to make sure that
we
know
have
your
a patient here that had surgery with you in March. She would like to know when. She had a BBL with you in March. She wants to know when can she come back to do her breast.
So we usually say 6 months in the same area. So we're actually right there, right? So March, we're at September. So come on in.
Oh, technically, you can call us today. We can get you in next week.
Absolutely. I mean, she's gone through that 6 month mark. She could have that. She could have it next week. Absolutely.
Awesome, my friend. And I've heard you have a BBL style. Can you tell me a little bit more about that?
I don't know if I
Or
have
a ballerina
BBL. Yes, I do
BBL?
offer the ballerina BBL.
Okay, tell me a little bit about
That's something that I enjoy. Just it's I mean, here's my favorite BBL, the one that the patient needs, because there's nothing like getting that patient the result that they want for their body. But if you want, I will talk about the ballerina BBL. That's the skinny patient. Who feels like, oh, well, this isn't for me, or oh, it's going to be so big, or oh, I don't want that, anything too big. The ballerina BBL is a natural look, almost like a little pop, a little pop of booty, I guess some people might want to say, and without so much the hips, and it looks very athletic. It looks.
So
like,
would you say this is like a little enhancement, just like we were saying just now?
Exactly.
Something proportionate to the patient's body, something that patient or maybe somebody else would look at her and say, I'm not sure if she had surgery or not.
Exactly. But that being said, I mean, I have another style I call kind of Miami natural, which is hourglass figure, hips. But again, also, keeps people guessing. So there are different levels, and I really drill down into that when I'm seeing patients in pre-op. I ask them to bring a picture, because here's what everyone says. I say, well, what would you like for your BBL? Not too big, not too small.
Oof.
Everybody says not too big, not too small. And then I say, well, do you have a picture? And then they show me a picture, and it's the whole range of sizes and styles. So it's very important that to bring up a photo, because I can do almost any style. I just
That's
tell
what
me
makes
what
it so amazing, though.
Yeah, it's got to be customized.
Just a little break over here. We have a patient here saying that she's scared. Let me just kind of respond in Spanish. Acevedo Ayala, mucho gusto. Gracias por estar con nosotros hoy. Veo por acá que estás nerviosa, que tienes miedo. Eso es completamente humano. Antes de cualquier procedimiento uno se asusta, se siente nervioso, se siente feliz y es completamente normal. Nos pasa a todos, pero te puedo decir que tenemos un equipo espectacular. Los médicos son muy buenos, los anestesiólogos son buenísimos también y todo te va a estar saliendo muy bien. Súper importante, análisis antes de cirugía, análisis de sangre, electrocardiograma y un medical clearance. Súper importante, queremos asegurarnos que te puedas operar y que estés bien, que estés en las mejores condiciones para operarte y que no vayas a tener ningún tipo de complicaciones. ¿Ok? Cualquier otra preguntita, colócamela por allí y voy a estar feliz de respondértela. Yeah, she's saying she's scared and what what she needs to do before surgery. Awesome. So let me ask you, doctor, where are you from?
So I was born in Jamaica.
Oof, I love that.
We left when I was a little girl, when I was about 3 years old.
Okay.
And we came to the United States so that my dad could go to graduate school at Princeton. So that was what brought us to the U.S. So those are my roots. I'm an island girl. I'm a Caribbean girl.
I don't think patients know that, but I do know for sure we do get a lot of patients from Jamaica or with Jamaican backgrounds, so it's awesome to know. I love getting to know a little bit more about you. Let me ask you, doctor, do you have, let's say, a favorite combo that you do, or just depending on what the patient
Mommy
is?
makeover was the procedure that got me into plastic surgery. So that was one of the first patients that I ever saw in aesthetic surgery as a resident. And I love that procedure because I consider mommy makeover almost reconstructive because it's aesthetic. It's all aesthetic, but it's a patient who wants to get back to the figure she had before
having kids,
before childbirth, and you get the breasts and you get the body, the trunk, the waist, a little bit of lipo in the flanks. So that procedure is very very satisfying.
Awesome. Something I really enjoy about that one is when we see patients that are fully healed from a mommy makeover and they say, oh, I'm able to wear the clothes that I used to wear before having kids.
Yeah.
Or, oh, I feel more about like myself now.
Yes.
So it does make a big difference, and we have to keep in mind that we see this every day, but for patients, this is a huge step.
Yeah.
Like just making that phone call to 305-209-1030 and saying, oh, I want to do a consultation, I want to do surgery with Dr. Sadio or any of our doctors. It takes a lot of courage for patients to do that.
Yeah.
But, you know, if you get to that point, it's because you don't feel fully comfortable and you want to fix a little bit, you know, a little something.
Yeah.
So it's normal. So if you're out there thinking of doing surgery or you know someone that wants to do surgery, let them know that they're able to schedule a surgery with, consultation with the surgeon. If you're in New York, if you're in California, in any state, we can actually do a free consultation with doctors like Dr. Sadio, which is amazing, and it's completely free. That way you can ask any questions that you might have to the doctor, because sometimes patients feel more comfortable when they speak to the doctor instead of just speaking to a consultant.
Absolutely.
It makes a big difference.
Of course.
So, super important. I see, let's read over here. I've been athletic all my life and now I'm suffering with sagging breast, but I have fullness at the bottom. What would you suggest? Breast lift or implants?
Lift with or without implants. The way I try to explain the lift is we're basically using your own skin to create a bra. And I think that image helps people. So if when you wear a bra with no padding, you're happy with your size, in other words, you're just lifting your size into position, it's a lift.
Okay.
If when you lift your breasts, if you feel small, then it's going to be a lift plus implant. And for the patient whose nipples are in the proper position and who doesn't need a lift, then that would just be a straight breast augmentation. It's very confusing. I even get salespeople texting me I'll be, in my car, and in my Uber, and I get text messages from the salespeople saying, and the consultants asking, oh, should she be a lift? So even for us, even among my colleagues, we'll discuss, what do you think? Lift, borderline? Ask us, and we'll guide you on that.
I believe it also has to do with what the expectations are.
Right, always.
Because we also have those patients that just want a little more volume.
Right.
So I agree
So
with you.
size and lift. You have to; those two are independent, and we can put them together in a way that gets you the result that you want. So again, the call isn't, I'm XYZ patient and I need a lift. It's, tell me about the look you want. When I'm in consultation with patients, I'd say, tell me about the look you want, not the procedure you want. Tell me the destination, and I'll help you get there.
Oh, I love that. That's
Okay.
amazing, doctor.
So-
So let me ask you, what would be an easy way for you to explain what's the difference between the breast lift and the breast reduction?
Okay, so a reduction would be, usually with a reduction, that implies a lift, right? So very few patients are perky and huge and just want to be smaller. I don't think I've ever seen that. So somebody with who wants a breast reduction just has too much weight. The breasts are too big. They feel frumpy and closed. Often the breast reduction patient doesn't feel like she can ever look really. She might be even fit, athletic, but she looks frumpy and bigger than she should in clothes. So again, size. Do you need to be smaller? That's a reduction.
Right. Okay, I understand. And I see here Lubabi asking us live, what is the highest BMI that you work with for Lipo 360?
I'm
Like a
gonna
max?
say, I will say 40.
40? Okay.
Really, just because of the limits of what we can do. But again, just some patients' BMI, they just wear it differently. BMI is one index. It's one number.
Right.
And so talk to us. It's free. You're not going to pay for a consultation. Tell us where you want to go, and let us give you a plan.
Let us guide you.
Don't dismiss yourself. Don't eliminate yourself from consideration, because we can get you there somehow.
Right. Okay, I like that. So the highest BMI, just to say a number, would be 40, but ideally, please give us a call so we can go through a whole consultation process with the doctor, because maybe your BMI is a different number, but we can still do it.
Right. Or maybe
Okay.
you have a weight loss plan. Maybe you have a weight loss plan in mind, and when you get to your goal, is it going to be a tummy tuck? Is it going to be a lipo? I find that if you know what your goal is, that will be more motivating for you.
Definitely.
With your weight loss plan. So we're not just here to push a surgery on you. At
Right.
least that's not my intention at all.
Right.
My intention is to get you where you want to go, and that might be 3 months from now, might be next week. But talk to us.
I had a patient, now that you say that, I had a patient that was doing surgery with Dr. Brewster, and I would speak to her weekly. She would call me weekly to let me know what her weight was. And she said that she had on her fridge, she had put the contract of the surgery and a photo of what she wanted to wear for Christmas.
Exactly. That gives me chills. That's exactly what I'm talking about. So this is why this question, I just don't, the question is a good one, and I'm glad she asked it, because I don't want anyone to put their numbers in a calculator online and say, oh, well, I can't get there. I can't get to my goal. Let us give you a plan.
Right. Maybe it's not going to be next week, but it could be in a couple of months. But we
Right.
can get you there.
Right. I love that. I love this image of her going week by week with her goal, and I love that.
Yeah, I love that patient. Is the fat transfer to the breast long-lasting? Do you do fat transfer to the breast?
Yes. Well, I personally don't do fat transfer to the breast.
Okay.
But it is permanent. Yeah.
It is
Yeah,
permanent,
yeah.
like a BBL almost,
Right.
right?
Exactly. So any fat you're going to place it's going to be permanent.
Okay,
Yeah.
awesome. And I see over here, who would be an ideal candidate for a tummy tuck?
Tummy tuck. So that's about skin. So any body contouring, whenever any area that we're working with, we're looking at skin and we're looking at fat. So, and when we remove a lot of fat, after that, that's why you have to wear the faja, right? The faja is
Right.
about training the skin. Even if if it's after the holidays, I wear my Spanx after the holidays if I'm trying to lose my 5 pounds or my 10 pounds because I know that I'm gonna have to train that skin. Why is that? Because we're removing the fat. So the tummy tuck patient is the patient who has a lot of redundant skin, loose skin, because if we just lipo that, the skin won't go anywhere. So we have to take the skin with it. Also, especially for the postpartum patient who has been kind of stretched, the muscles have been stretched.
Correct.
No amount of working out, and I'm of course an advocate, and I work out. I'm an advocate of exercise, but no amount of weightlifting is going to repair a diastasis, of the abdominal muscles. It's
Correct.
just not. It has to be repaired surgically. So that patient is also a candidate.
Let me ask you, and this is a question from one of our patients. Would you recommend having a tummy tuck first or a lipo first and then doing the tummy tuck?
I like the lipo first because if you think about it, what are we doing with lipo? We're removing the fat and then we're leaving
Like cleaning
skin.
up.
So the tummy tuck becomes the cleanup where we would take all the skin that needs to go. So for a high volume lipo, that would not be a bad approach. Also, we can take more fat if it's a lipo only case.
Right.
Whereas with a combo, we have some
And you
limitations.
can use that fat, transfer it to the butt,
Exactly.
and then you come back, remove the skin, and you're done.
Exactly. So I love that. I love that sequence.
Yeah, awesome. What would be the right procedure for someone that has excess skin on the thighs?
Extra skin on the thighs, so that's going to be probably like a thigh lift.
A thigh lift?
Yeah. So any loose excessive skin where lipo is not going to be indicated is going to be a lift. So that could be an arm lift, brachioplasty, a thigh lift. For patients who've had massive weight loss, now we have so many patients on the semaglutide medications, and they have a lot of excess skin. Those are the body lift procedures are the ones. For
So
that.
basically, in this case, for our awesome patient, Marlene, the correct procedure would be a thigh lift in which you would recommend just skin.
Right.
Correct?
Well, skin and fat, but we would be it would be an open procedure. In other words, something with an incision, as
Okay.
opposed to just lipo.
Okay, and the incision would be on the inside of the thighs.
Well, she's saying that she's an inner thigh. She's okay, I'd have to look at it because if there's a lot of skin, then we would do a thigh lift. But if it's just fat, then maybe we could just do lipo. So that's one where I would probably need to see the photo.
Okay, Marlene, so we have to evaluate you. Send us your photo so we can show the doctor.
Yeah, let me see what you got.
Awesome. And how much fat can be removed when you're doing arm lipo?
Arm lipo, as much as we need to get you the result. The max limit here in Miami is 4 liters. So anything up to that is fair game, and we're not going to get 4 liters out of your arms.
Correct. So basically, in the state of Florida, there's a maximum amount of fat that can be removed per procedure, which is 4,000 cc's for procedures like lipo or BBLs. So if you're doing, let's say, arm lipo, the maximum that can be removed is 4,000 cc's or 4 liters. If you're doing that with lipo 360, that's all together, correct? Lipo
Exactly.
360, abdomen, waist, back, and arms.
The total,
4,000
whichever-
altogether.
Yes, exactly.
Awesome. That was a great question.
Yeah.
She's asking if you do a thigh lift, what do you wear afterwards? A faja or
Yeah, you'd wear
like a bandage?
Yeah, you'd wear the faja. Yeah,
Awesome.
Sure.
Are we able to do the thigh lift under local? No, right?
No. An
You wouldn't recommend
open
it?
procedure we don't do under local.
I understand. Okay, you're very welcome, Victoria. Now, someone's asking Miss Bella, she's asking if you do a breast lift and lipo, BBL, how much are you able to take out? As for fat.
How much fat? So if it's a combo, in this state, it's 1 liter.
Okay. Awesome, Doc. I do understand. Let me ask you, do you have a BMI max for combo procedures? I know you said max 40 for single procedures.
Yes, when we're getting into combos and we're getting into open cases, usually, I'd like to say 33.
Okay, I understand.
yeah.
Perfect. And let me ask you, doctor. Oh, I heard you have a BMI. Do you have an age requirement? Like, what's the youngest you could work on?
I mean, the youngest would be of age of consent, so an 18, 18, 19, yeah.
Okay,
that would be-
18
that would be-
and an age for like the oldest?
I don't want to give a number because I'd have, there are patients who are in their 30s who are unhealthy and who are not a candidate, and then I've had a patient 2 weeks ago who's in her 70s. She did beautifully. So it's just about getting the medical clearance and and making sure that you're healthy and you can that you're a candidate for the surgery. I don't set any age limits.
Okay, so now something super important. In case you have any medical conditions, it's really important that you let us know when you're doing your evaluation, or if you booked already, that you tell your coordinators. So in case you need any specific medical clearance, in case you need to stop any medications, we need to let them know.
Yes.
Sometimes patients are scared to say, oh, I have something as simple as hypertension, because they think they could get canceled. Super important. We can do surgeries as long as you're controlled. If you have hypertension, if you're anemic, if you have diabetes, anything, you just need to let us know so we can make sure we can do the surgery in a healthy, safe way. Okay, that's something very important. I'm having my surgery with Dr. Sadio in October. Miss Tara, we're very excited for you.
Can't wait to meet you. What's she having done?
What are you having done, Miss Tara? Let's see. She's going to answer now. Now, doctor, what would you say you require for patients to do before surgeries? Or not require, what do you recommend for patients to do before? Vitamins or
get
diet?
Healthy nutrition. So if you think about it, with any lipo, with any open procedure, we are asking the body to heal, right? We are asking that we're doing we're altering the body, and the body is going to want to heal, and so that's very important. The nutrition, iron, making sure that your hemoglobin is up. For those in cultures where I always tell patients, if you're part of a culture where you eat liver, or you enjoy liver, or even if it's pate. I mean, I like pate.
I've never had
Take
that.
it. Eat. The liver is very, very good
For iron?
for your hemoglobin.
I didn't know that.
Absolutely, for your iron levels, very, very good. So make sure you're getting healthy proteins, stay away from processed foods, get fit, and get yourself in a mindset of success. That's the other thing, is come into your procedure, ask all your questions, and get yourself in a place where you're going to feel confident that it's an event. I almost think of this as like it's almost
a big event.
It's like an athletic event, right? You got to get yourself. You're doing a marathon. You get yourself psyched up. You get yourself prepared, and so on game day, you've done everything that you could, and that you're going to get through that, and with resounding success.
I love that. So Miss Tara just responded, thank you. She says she's having Lipo 360 and BBL.
Yay.
Let me tell you, that's one of our most popular procedures, I would say.
Yes.
That makes such a nice change in the bodies.
Yeah.
So let me ask you, Tara, are you ready? Do you do labs already? Do you have any questions for our doctor? You have our attention now.
Yeah,
Super
Talk to me.
important. Let me ask you, how long do you recommend for patients to not sit on their butts after a BBL?
Excellent question. So I say 3 months.
3 months.
1 month, absolutely 1 month. Being very, very careful, and then you can maybe back off a little bit. But 3 months is really important. If you think about the fat grafts, they're almost like if you're planting seeds. I don't know if anybody out there gardens, but if you're planting something from seed, and then you get the little saplings, and then you get the little shoots. They're delicate.
Yeah.
They're delicate. And so that's what, when we place the fat was living in your body elsewhere, minding its own business, and now it's been sucked out and placed in an entirely new area. It has to develop new blood supply. It has to.
That's an interesting way to explain
it has to
it.
find its footing, and it has to, and so it's very, very delicate in those early weeks. While it's getting its blood supply, so that's how you want to think about it. You wouldn't step on a freshly, on seeds that were just starting to sprout. You would baby them until they were more robust.
Have you heard of this BBL fluff or something like that?
Yes, I've always heard about this fluffing of the BBL. I don't know. I just. I keep it simple, protect your grafts, take care of yourself, walk. I think sometimes some patients, not all nowadays, but in the older, longer time ago, I found that patients were like almost afraid of their incision, afraid to do anything. They felt that they were like had to be on bed rest. It's the opposite. It's important to not be, no strenuous exercise, but to get, walk, engage in activities of daily living. It's very important.
Right. Do you believe any specific foods help you after having a BBL?
First, bruising and swelling, pineapple. Pineapple has bromelain, which is excellent for inflammation and bruising. And that was a new idea, when I was in training. But now, that's just, I would definitely. Pineapple was definitely helpful. Arnica, I recommend that patients use arnica cream.
It has a lot of benefits.
Yeah, absolutely. The cream, and some people like the teas and the capsules. So arnica is very helpful. But in terms of specific foods, again, the liver if you have a low hemoglobin. But other than that, just healthy fats. Protein. You've got, especially for like I get patients who've had gastric bypass, patients who have lost a lot of weight, and in some of those cases, their nutrition might be wanting. So really, it's so important to get the macros in, as we say, the proteins and the healthy fats.
Something I tell patients a lot when they're asking me what to eat, I say, eat real food. Because sometimes we see patients here that say, oh, I'm not hungry. I know they're in pain, they're uncomfortable, but they just have like crackers and fruits. I'm like, no, eat real foods. If you like chicken, get chicken. If you like fish, get fish.
Absolutely.
But you need to eat real food.
Yeah, agreed.
Now, Ms. Tara said, I had 2 kids and have a little loose skin in my, is my results still going to come out right?
Yeah, absolutely. You have to, again, you don't really know until after the full recovery period. I tell patients it's 6 months of swelling.
Definitely.
Obviously, you see your result immediately. You're not waiting 6 months.
You have like a little peak.
Exactly. But the transformation is immediate. You'll see the next day. But there's swelling on top of that. And so the first month, very dramatic. But the first 3 months is when I think you can start to see the final result. And then 6 is the final. And this loose skin, everybody's so different. And I like to look at patients and just kind of look at the rest of their body, and you can kind of get a feel. But I'm so surprised sometimes by some patients. You think, oh, that skin's going to be so loose, and they just snatch right back.
Right. We don't know how their skin is going to react after having lipo.
Exactly.
Some patients have really good skin, and not only that, the massages help, the garment helps. So would you say the post-op is as important as the surgery?
I always tell patients, I am doing 50%, and that post-op recovery is truly the other 50%. The patients who stick with it, who do the massages, who are attentive with the faja, who they buy the BBL mattress, so they're protecting and babying those grafts. They just get better results.
Definitely. So super important. If you're having a BBL done, a lipo, a breast procedure, a tummy tuck, the post-op is super important. So try to do as good as you possibly can. Try to eat good, try to wear your faja, try to do massages. If you have any questions, let us know so we can guide you or send you the instructions. But it is really important. Also, you need to have someone that's going to be taking care of you. You cannot live by yourself. So make sure to have an adult or a nurse that can take care of you so that you can be okay, so that you can rest, you can eat, you can be taken care of. Okay, so I see this is a different one. She lost 80 pounds and she does have loose skin. She said, I need a tummy tuck, but I also want a BBL. Will I still be able to do a BBL first?
Yeah, the BBL first is perfect. That's exactly what I was going to say.
Definitely.
Do the BBL first. Let's get all the remaining fat. You lost weight, but I'm sure you still have fat. I'm sure you still want your waist,
There's always a little fat here and there.
There's always, and it's also about the sculpting, right? When you just lose weight, you're not getting sculpted. You're just losing weight. So now we can use that raw material to really sculpt and get the contour down. Do the BBL, use that fat, and then finish up with a tummy tuck. Chef's
Awesome.
kiss.
Not only that, but if you want to, since you're coming for the tummy tuck and you want to do something to your breast, it's perfect because you're going to recover on your back. In this
Exactly,
case.
exactly.
So you're able to do your tummy tuck, remove any skin, and if you want to do implants, if you want to
Exactly.
do a breast lift, that's the chance.
It
You can do it
really-
in one session.
It really does make more sense to do all front procedures in one shot and all back procedures in one shot. But we can work with that.
I understand. Now, something I would like to mention. Dr. Sadio does consultations in person and virtually as well. Not only that, but she does have some specials right now. So if you're interested in booking a procedure, give us a call today, 305-209-1030, or send us a DM with your information. One of our consultants will contact you. And like I said, we also finance. So if you would like to book your procedure, it's only $250 to reserve to book a date. And then you're able to finance the rest. We have companies that can finance with up to 24 months with no interest. You just have to give us a call today. Okay? Awesome. So we're done for today. Thank you, Dr. Sadio. It's been a great time
It's been
talking
fun.
to you
I
today.
love chatting
And
with you,
we're going to
Hillary.
be waiting for your call. Okay? So like I said, 305-209-1030. Thank you so much.
Bye.
Dame un grr,
¿Un qué?
un grr,
¿Un qué? ¿Un qué?
un grr,
¿Un qué?
un grr,
¿Un qué?
un grr. Dame un grr,
¿Un qué?
un grr,
¿Un qué? ¿Un qué?
un grr,
¿Un qué?
un grr.
¿Un qué?